Hello everyone, my name is Nurhashimah Dahlan. Today I will present about the iodine deficiency case study in children. Here is the outline of my presentations. And next, move to the patient background. BD, a 15 years old male orang asli and living with his parent and 6 siblings. He is collecting honey in his daily basis. So for the medical diagnosis, iodine is an essential nutrient needed for the production of the thyroid hormone. So the thyroid glands and concentrate the iodide and use it in the synthesis and for the storage of thyroid hormone. The insufficient amount of iodine in the body will lead to the impairment of the thyroid hormone production and eventually will cause the enlargement of the thyroid, which is known as goiter. Okay, there are a few diagnoses that can be done to determine the iodine deficiency, such as urine test, blood test, iodine patch test, and iodine loading test. The most simpler form is urine test. The urine is collected at one point and the iodine is determined within the minutes. Next is the second test, which is blood test. The iodine in the blood is determined. And the third test is iodine patch test. Iodine patch is placed on skin and let stay for 24 hours. Next is iodine loading test. The amount of iodine secreted in urine for the past 24 hours is collected. So this is the iodine recommendation for every life stages. The most significant amount of iodine needed is among pregnant teen and women, and also breastfeeding teen and women. Here are some symptoms of iodine deficiency, such as goiter, hypothyroidism, fatigue, hair loss, increased sensitivity to cold, dry skin, slow heart rate, and heavy or irregular period pain. So, what is goiter? Goiter is an abnormal enlargement of the thyroid gland. Thyroid is a butterfly-shaped gland located at the base of the neck, just below the Adam's apple. So, not all goiter cause signs and symptoms. When the symptoms include a swelling at the base of the neck, a tight feeling in the throat, cough, hoarseness, difficulty in swallowing, and difficulty in breathing. So some of the complications of iodine deficiency include in women it may lead to miscarriage, preterm delivery, stillbirth, impaired ovulation, and some cancers such as breast, ovarian, prostate, and colon. Whereas in children it may cause congenital abnormalities, cognitive impairment, growth impairment, nervous system impairment, and then cretinism in a severe cases of iodine deficiency. Okay, for the medication, levothyroxine such as Levoxil, Synthron, and Thyroxine are prescribed for the patient with the goiter, which is function as to slow the release of thyroid stimulating hormone from the pituitary gland and reduce the size of the goiter. Okay, next we move to nutrition care plan, a DIME assessment, diagnosis, intervention, monitoring, and evaluation for this patient. Okay, firstly we move to anthropometric assessment. As can we see from the table, the patient is underweight with BMI of 15.2 kg per meter square. Okay, next is biochemical or clinical assessment. Based on the table, we can see that the blood pressure value is 125 per 80, which can be considered as quite high and can be characterized as pre-hypertension. Okay, this is the dietary assessment for the patient BD. Based on the table, we can see that he did not meet the percentage of requirement for carbohydrate, protein, fat, and kilocalorie per day. Okay, for the exercise assessment, BD is an active boy as he is collecting honey in the jungle on his daily basis. He needs to hike in order to collect the honey. Okay, this is the diagnosis for the patient. Number one is swallowing difficulty related to goiter as evident by weight loss of 3 kg. Secondly, inadequate energy intake related to difficulty in swallowing food as evidenced by total estimated energy intake 1165 kcal per day at 50% from energy requirement of 2000 kcal per day and BMI of 15.2, which is underweight. And thirdly, inadequate mineral intake, iodine related to lack source of iodine source food as evident by goiter. Okay, as for the intervention, the energy is calculated and the chosen one is 2000 kcal per day. From 2000 kcal per day, 50% is from carbohydrate, 20% is from protein, and another 30% is from fat. Okay, the objective or principle of the treatment intervention is firstly is to promote the increase of energy intake to meet the energy requirement by addressing the swallowing difficulty to enable sufficient intake of energy, such as encourage the eating of blunt food that are soft and smooth, take a small pieces of meal, eat slowly, advise to eat one food at one time, encourage of eating small chopped food or minced food, encourage frequent small meal and snacks, maintain upright position whenever eating, do not mix solid food and liquid in one mouthful. So the second objective is to increase the intake of iodine in daily meal with principle to promote the consumption of iodine-rich foods such as dairy products such as milk, eggs, salt, water, fish, seaweed, and potatoes. Sprinkle iodized table salt on top of meal, depend on the meal, and encourage drinking of iodized mineral water. Encourage the use of fortified ingredient with iodine to make meals such as fortified flour and fortified bread. So based on the energy requirement of 2000 kcal per day, this is the distribution table. This is the menu planning for 2 weekdays and 1 weekend. I emphasize on choosing soft and blunt food while providing a high amount of energy and protein, and in addition, modify the texture of food to address the swallowing difficulty so the patient can eat easily and thus improve the nutritional quality. Okay, this is the continuous menu planning from the previous slide. For the monitoring and evaluation, for the anthropometry, the focus is to assess on weight change. The goal is to ensure there is weight gain of the patient. For the biochemical, to assess the biochemical profile, to maintain good close to normal biochemical profile. And lastly, dietary, to assess on the patient's compliance to dietary recommendation, which is to ensure the patient comply to dietary modification and recommendation. So for the discussion, the main concern of the patient is iodine deficiency that result in the swallowing of the thyroid, which is goiter. Goiter impact the capability of swallowing, thus resulting in poor nutrient intake and weight loss. In addressing iodine deficiency, first is important to have adequate source of iodine in daily diet, first and foremost, and then a modification of food intake preparation is prioritized while dealing with the goiter together with a proper medication. According to SARA 2010, thyroid disease, especially the iodine deficiency, is a common pediatric disorder that affects up to 3.7% of school-aged children between the age of 11 to 18 years old. Okay, for the introduction, iodized table salt is the most simple form of iodine source. WHO, UNICEF, and ICC/IDD stated that 90% of the households should get iodized table salt at the level of 15 part per million to prevent the deficiency. According to Barbara 2013, children who frequently taken more salt in adequate amount were at low risk of iodine deficiency. Apart from that, iodine content in the drinking water indicates whether the region is environmentally iodine deficient or the soil is poor in iodine, according to Chandra 2006. There are three types of iodine deficient zone, which is severe deficient zone, moderate deficient zone, and relative deficient zone, as shown in the table. So, consuming iodine-rich food may prevent deficiencies such as potatoes, cottage cheese, shrimp, milk, egg, dried prunes, iodized table salt, and cod, which is saltwater fish. In addition, among the causes of insufficient energy and nutrition consumption, dysphagia is one of the causes, according to Patricia 2010. The use of modified texture food and fluid are highly associated with undernutrition, according to Heater 2012. For persons with dysphagia, TMF will reduce the risk of aspiration and easier swallowing capability. So the recommendation include eating soft, blunt food, liquid food, proper food preparation, and keeping the meal small and frequent. So as the conclusion, nutritional intervention should not only treat and prevent the endemic goiter, but also attend to the energy and micronutrient deficiency in this patient or children. So along with medication to treat the goiter, a proper meal includes the iodine-rich foods, and the preparation addressing the swallowing difficulty is also important. So this is the references. And then thank you. That's all from me. Bye.